Hello. On behalf of Health and Human Services and Centers for Disease Control and Prevention, I would like to welcome everyone to a National Influenza Vaccination Disparities Partnership webinar. My name is Adam Unson, and I work for Kaufman and Associates. Carlos Velasquez with HMA and Associates, and I will be the moderators for today's webinar. Before we begin, I'd like to mention some housekeeping items. There are two main features of your webinar interface. You can see the first PowerPoint slide of the presentation in the main window, and the Q&A box is in the bottom right-hand corner. Today's question and answer period will be at the end of the presentation. However, if you have questions for our presenters, feel free to submit your question at any time. If you need technical assistance during the webinar, please enter your tech support question in the Q&A box. Our tech support staff will be monitoring these questions throughout the webinar, and we will work to answer your questions right away. You'll receive an answer in the Q&A box. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online at cdc.gov. With those announcements made, I would like to welcome everyone to today's webinar and hand it over to Carlos Velasquez.
Thank you so much, Adam. It's great to be here with all of you, and thank you so much for calling in and joining us online. We're very excited for our second part of our series of webinar sessions that are aimed at being able to have some engaging conversations about how to reach underserved communities. And for this session, we have a very distinguished panel, and I want to begin by introducing Dr. Arlene Lester, who is the Regional Minority Health Consultant, Office of the Secretary, U.S. Department of Health and Human Services in Region 4. We also have Claire Hammond, the Executive Director of the Association of Immunization Managers, or AIM, and Josana Sonda, the National Coordinator of Ventanias de Salud Program, and Catherine Martin, the Executive Director of California Immunization Coalition. Today, for our objectives, we have an opportunity to share lessons learned from experts working within regional, state, and city health jurisdictions about promoting flu vaccination among underserved communities. We'll have an opportunity to identify effective strategies to share resources with partners and increase flu vaccination promotion activities. And finally, we'll be able to review initiatives that promote flu vaccination among high-risk populations. And some of those initiatives may take the form of policies, because we know that some of you have been very successful in being able to implement them. And I'm sure that we'll hear from our expert panelists about what is working, what is a best practice. And I have the distinct pleasure of having Arlene Lester with us this afternoon or this morning, depending on what time zone you're coming in from. We've been a long-term partner with the Department of Health and Human Services, and in fact, the campaign to promote flu vaccination was done as a true partner, hand in hand, in being able to promote vaccinations. And Dr. Arlene Lester has been a long-term ally of NIVDP, and it's a pleasure having you on the call today. Arlene, tell us a little bit about your role in the office and some of the incredible work your office has been doing.
Thank you, Carlos, for that warm introduction. As you said, I'm Arlene Lester, and I'm with the HHS Office of Minority Health for Region 4. Region 4 for the department is the largest geographic territory. We have 63 million people in the territory, and about 37% are racial ethnic minorities and long-standing public health challenges. The reason of our office is quite simple. It is to improve the health of racial and ethnic minority populations, and we do that through developing of health policies and programs like the vaccination partnership that we have with Carlos and with people, and the whole purpose is to eliminate health disparities. So that's just a little bit about that. In Region 4, we look at a variety of partners to do that. and I'll share a little bit more about that later as well.
Great. Thank you so much. And I also have the pleasure of introducing Claire Hammond, who I've known about for quite some time. And last year I had the pleasure of seeing her present at a conference, and I was so impressed by her ability to go through some very complicated data and making it sound so real and so engaging. And I thought, someday I want to call up on Claire and say, hey, do you mind being on a panel for our session? And she was very quick to say yes, and I'm very honored to have her here. And hopefully also in the future, I can say a long-term partner. Claire, tell us a little bit about yourself and the work of AIM.
Well, thank you so much, Carlos. You're setting the bar pretty high. I think you might have seen someone else, but I am so happy to be here. I am the Executive Director of the Association of Immunization Managers, or AIM, and AIM is a nonprofit membership association, and our members are the immunization program managers out in the 50 states and the 6 cities and 8 territories that are known as awardees. These programs receive direct funding from CDC to conduct immunization activities and strategies to improve rates. And what we do here at AIM is we share information with them, and we provide a forum for them to share best practices and share what's working. And yes, we do collect data, and I try to make sense out of it. But I'm happy to be here, and I do want to mention we have a few resources that we've just recently released. Our adult resource guide has many strategies on improving adult immunization. We're currently working on one for adolescents, and we also have a few that deal with working with diverse populations in our Bullseye Awards. So I will be happy to share them with you after this presentation. So you can share them with those on the webinar. So thanks, Carlos.
Thank you so much. And then I really have the great pleasure of introducing someone who I almost call an hermana, a sister, who's been with us from the very, very, very beginning. And Hosanna Tonda is someone that I can confide in and sit down and have a cup of coffee when I know that there's a lot of work to be done within our Latino community. Hosanna, I know you're the national coordinator for the Ventanillas de Salud programs with the Mexican consulate. But tell us more about the great work that you're doing through the Ventanillas de Salud program.
Thank you, Carlos. Gracias. Thank you for this warm introduction. You're also an hermano for me, so thank you. Thank you again. My name is Hosanna Tonda. I'm the national coordinator of the Ventanillas de Salud program. I work for the Institute of Mexicans Abroad at the Foreign Affairs Ministry, and I'm based here in New York City at the Consulate General of Mexico. Well, first, thank you, Carlos, again, and the great team from HMA. I think this is a great opportunity, and I'm looking forward to having this discussion during the webinar. The Ventanillas de Salud program is an on-site health access and education program that is located in the Mexican consular offices across the United States. Our program services include culturally and linguistic appropriate health education and information, and we provide a diverse menu of screenings and referrals to clinics and community health centers. What we want to do is to help individuals to establish a medical home. We serve an average of 1.5 million people a year, and we have 52 Ventanillas de Salud sites in operation. And we launched last year. Between last year and this year, we launched 11 mobile units that are in different parts of the United States. The flu campaign has been, it's a long story how the Ventanillas de Salud started getting involved. We started when the H1N1 outbreak in 2009 happened, and we started working with the Department of Health and Human Services, providing messages and then coordinating through clinics through all the network. So, again, this is a very interesting and great opportunity to share our experience, our strategies in terms of how to get to underserved communities. And I want to just highlight that HMA was also part of all the work that we developed to make this campaign so successful. So thank you, Carlos.
Oh, you're very welcome. I'm glad you're with us today. And I will say that my West Coast hermana is Kathleen Martin, who has been so supportive of NIVDP and all the big efforts of the CDC and HHS for quite some time. And we've done some specific outreach to Latinos in California. It's been great to have you on board and to be always supportive, a great ally. Catherine, tell us about what California Immunization Coalition does and your work.
Thank you very much, Carlos. So I've been the director of CIC for about 10 years now, and I've been involved with coalitions and immunization programs for over 18 years. So, and in that time, I had the great pleasure of working with some tremendous people, including you, Carlos. I remember meeting you at a national event, and for those in the audience, if you've ever heard Carlos ask a question or give a presentation, you're always in for a treat. So thanks for including me today. So our California Immunization Coalition is a statewide nonprofit, and we focus primarily on advocacy and education with the goal of improving immunization access for all Californians across the lifespan. And we continuously work to increase and maintain our immunization rates, of course, like all of you. We work really close with our state and local health departments and our local immunization coalitions and try to make an impact on a very large and diverse state. Through our advocacy work, we developed and strengthened our network of partners, including professional associations like our AAP, AAFP, our medical associations, health plans, provider groups, hospital, school nurses, to help move those rates up and maintain those rates. Let's see. And we've also been able to, as a coalition, work more closely with our other state coalitions and develop partnerships and help build capacity with the other state and local coalitions. I'll mention that a little bit later as well, as far as ways that we can work closely together.
Excellent. Thank you so much for being on today's webinar. So I'm going to move now to some questions that we have prepared ahead of time. And then after we've gone through the prepared questions, we'll have a chance to go through a Q&A. So if you have a question during the course of any comment that any of the presenters are giving, please use that little question box, and Adam and Tony and all the people behind the scenes that you don't see or hear will actually process those questions for me, and we'll address them for sure. So the first question I'm going to be asking of Arlene is around the challenges that you have faced when promoting flu vaccination among underserved communities. What have you seen, Arlene, and tell us a little bit about what your experience been?
Oh, thank you, Carlos. That's a really great question. I would say that there are several challenges in keeping underserved communities motivated to get an annual flu vaccination, and I'll just talk about a few. One is that individuals in these communities may be unconcerned about the flu, or have a conflicted belief about their own risk versus the risk of others in the community. Said differently, it won't happen to me, what's the point, et cetera, and they have that type of a mentality. On the other hand, you'll have individuals in the community that may have varying levels of awareness or their attitude towards the vaccine. Some people may have had it and had side effects, and some didn't have any side effects and got the flu. And, anyway, after they got the shot or never got the shot and never had the flu. And so you have this kind of thing going back and forth that presents a challenge to having overall effects in that particular community. And then you have individuals in the community with competing priorities, particularly with our underserved communities, just keeping food on the table, maybe child care needs, oftentimes single-parent households, et cetera. So, other things take a back seat to vaccination. And this makes it really difficult to capture their attention about the importance of having a vaccination, or to get them even interested when it comes to the season. And finally, I would say sometimes there's a barrage of information coming at those who might be listening, and this could lead to, I would word as desensitization of, they're just tired of listening to it on that end. And then the last thing I said finally, but just one more thing that I think is critical, and this is from a social and economic perspective. We do have some communities that are more well off than others. And so you may have better resources or community health services that deliver vaccination efforts or activities or treatments. And naturally, we want to see uptake and the rates go up or immunization, vaccination goes up. But in other communities, we don't have the same thing. The economic spectrum is lower, income is lower, and the two together account for this variation that we see that at the end of the day adds to a challenge. So there are multiple challenges. They can all be addressed in one way or another through either policy or through just qualitative efforts. And it's just a little bit of what I've seen over the years.
Thank you so much, Arlene. And now the charge of NIVDP is to work specifically, at least for this year, within the Latino and the African American community. So I'm going to ask the question specifically about the challenges that you have encountered, Hosanna, in relation to promoting flu vaccination among the Latinos who are underserved, or Latinos in general for that matter as well, because challenges exist everywhere. Hosanna, what have you seen?
Yes, Carlos. It's a great question. So I think the challenges that we have faced are related to the evolution of the influenza campaign that we had through the Ventanillas de Salud. So as I mentioned before, we started the campaign or building up this campaign when we had the outbreak of the H1N1, and at that time the strategy was, or the first challenge was to explain to people what was this kind of influenza, right? And also the access, well, at that time we did not have the vaccine yet, so it was just sending messages to the community about how to be more protected or where they could find more services or where to find more information. And then when we started doing more, when the vaccine was developed, and then we started having flu vouchers before having flu clinics, and I'm making here a difference because first we distributed flu vouchers, and then we didn't know if that people, they went to the pharmacies to get the vaccine. So the challenge was really the access to the vaccine. And then I want to highlight the importance of, or the evolution that we had. And again, we have a very, very strong collaboration with the Department of Health and Human Services, HHS, the National Vaccine Program Office. We were very lucky. So we started working together, and then Walgreens just got into the collaboration, and the access was actually much more developed. We could do more clinics. But the other part of the equation as a challenge was first the access, then the message. We had to work on making people understand that it was important to get vaccinated. And also the way that we started developing the educational materials, and Carlos, you are part of this team that developed all those materials, was first to who do you have to vaccine? The pregnant women, children, people who are older people. So one of the challenges was, what is the message that we have to send? So we finally created this message that you have to get protected, you have to get the vaccine for yourself, and then it's the best way to protect your family. So I think it's important to see that the challenges related to what we have been doing through the years. And but as I said, access was the first challenge, and the second one was the message that we wanted to share with underserved communities, especially the Hispanic community, in terms of what is the vaccine for, and what is the best way to and why do I have to get vaccinated? Thank you.
Excellent, Hosanna. And I'm going to piggyback on what Arlene and Hosanna both shared, because it's one thing to develop a message, it's one thing to have access, but there are so many misconceptions that are held within communities. And so the next question I'm going to ask of Catherine and Claire, what lessons have you learned when promoting flu vaccinations among communities that hold misconceptions that are hard to change? And we'll start with Catherine.
Thanks. So I think no matter what community you're working with, it's really important for our healthcare providers and the folks that are administering the vaccines or introducing the vaccines, reminding patients that they need to get their vaccination when they're in the office, et cetera, that they have the tools to be able to answer these questions, because the research shows that this is where patients want to get their information. They want to hear it, they're happy to hear a commercial, see a billboard, get a flyer, but it's really accepted best when it comes from their healthcare provider. And we need to make sure, and that's what our coalition do, is to make sure, try to make sure our providers have the tools to be able to respond to the questions, the misconceptions, and listen to those concerns that patients have, no matter what your background is. And, of course, having the culturally appropriate materials really helps to back that up. And at the same time, it takes time for them to be able to get this information out, and that becomes a challenge for some offices, right? Because they're always running, get as many patients seen as you can. If patients have a lot of questions, it can be a time-consuming effort. Plus, again, some providers don't have all the information and may not be as on board as we like as well. So I think it's really important to make sure we are educating our healthcare provider community as much as possible about these communication techniques, and to make sure that they are being really strong supporters as well, which is also hard because it seems like flu season is becoming year-round, whether it's preparing for it, administering it, reminding patients in the community.
That's an excellent point, Catherine. I've heard the CDC and other folks talk about the fact that no flu season is like any other flu season. So I hear you with. Claire, for you, in talking to some of your members and constituents, what have you heard in relation to how do you counter those hard-to-change misconceptions?
Right, and I would definitely echo what has been said by Catherine and Josanna. One of the things that was talked about with my members was really taking the time to go into these communities and to find out how, what the messages resonate, what motivates them to protect themselves and their families. Because there's research that shows, that sources that are deemed similar to the viewer and that are trusted are more persuasive. And so we've seen successful campaigns and messaging that are really based in the community. We have an example from Minnesota where they did focus groups. They worked with the media outlets. They worked with their refugee programs to find media outlets that were trusted. And they used those media outlets to run ads to get messages out. So that can be very successful. And also, I would say, trying to really, over time, shift the social norms to really normalize flu vaccination as a part of family life. And we have some examples of that. I think school-based clinics are really good example of that. In Maryland, they've been doing school-based clinics since 2006, and the flu vaccine is provided for children regardless of their income or status, and they create special efforts to reach children in Title I schools. And the program has normalized flu vaccination to now we're at the point that parents expect it. And, they just expect to get the consent forms. And it's really, they don't have as many questions. They've done it. It's safe. It's successful. And they feel good about getting it for their kids. So I think, that time element and really working in the communities to see what message resonates and using those community advocates to establish trust and get that message out.
Excellent. Thank you so much. Now, Arlene, you were talking earlier about that in some communities it's a little harder to counter this misconception, but I know that at least in the research that we've done with Kaufman and Associates and the CDC, is that at least within the African American community, there are a lot of misconceptions that are difficult to counter, but there's a historical and a social element there. Can you touch upon that, Arlene?
Yes, sure, Carlos. That is true. There are some historical things that have been done. Most folks will remember back to some public health studies that may not have been fair and transparent as we should have been, and that has kind of been a long-term thread, I would guess, through the community. But in thinking about that, though, that cannot be the reason or the excuse. It's certainly what one to push forward. And personally, as an individual that's worked a lot with the African American community, I think the key to it, if I can use the word, is all hands on deck to overcoming this, any stigmatism or any past mistrust that may have happened. And when I say all hands on deck, I'm talking about it from the bottom up, making sure that there's open discussion, communication with the mothers of children. Get into the facts.
Sorry, Arlene, we're beginning to lose you a bit, so if you can repeat the last thing you said. And we may have lost Arlene, but we'll come back. Hosanna, one of the strategies that I know that's been very effective has been a matter of being able to work within the community, as Arlene was touching upon earlier. And part of that is being able to know how to leverage resources in partnership with other organizations to promote flu vaccination. Can you tell us a little bit about your experience being able to leverage resources?
Sure, Carlos. I think in our experience, you have to be very strategic or create really strategic partnerships to promote flu vaccination. So let me give you an example. I was actually mentioning the Minnesota experience. And I want to particularly mention the program that we have in St. Paul, Minnesota, the Ventanilla de Salud, because they created a strategic partnership called the Minnesota Immunization Network Initiative. And those guys were part of this initiative. And it was an initiative where you have the Minnesota Department of Health, community-based organizations, churches, clinics, schools working together to expand the access to the flu vaccine. And that was very, very successful. And so it's kind of how you should integrate different types of organizations to promote the access of the vaccine. I mean, going to different places and do the flu clinic, and then through the educational part, which is how to send the message, how to explain, how to have people who are bilingual, who are culturally sensitive, and have this approach to the community. So I mentioned the VDS in St. Paul, but we have other cases very successful, or when we have this strategic partnership composed by different members of the community again, and I think that was very useful to have a successful campaign in the year.
Excellent, thank you. And I know that Minnesota has done such incredible work, not only in terms of the community-based organizations working with the Mexican consulate, but also as the health department. They've done some really interesting, innovative messaging. And so I don't know if you have anything that you can share with us, Claire, down the road, but if there's a link that you can share with Adam and he'll get it out to all participants, that would be wonderful. So I think...
Yes, I do, and I will.
Wonderful. I think our video back with us. And you were talking, Arlene, about the resources. Are you back with us? Okay, we'll get back to Arlene in a bit. I want to talk a little bit about some of the successes, because we've heard about Minnesota, but I know there are a lot of other successes that have been developed as a result of the partnership and through all the great work of the health departments and HHS and the CDC. So, Catherine, if you can tell us a little bit about the successes in getting community partners involved in flu vaccination activities.
Sure, and while I'm referencing your last question a little bit in this answer here, because I was thinking about some experiences I had early on in public health. My experience was in public health in 1999, 2000, when we had some brutal flu years and shortages, and how our community in Fresno County, Central Valley of California, came together, emergency services, the health officers, all sorts of community groups, and we came together to address some of the issues and try to mediate a lot of the problems that were occurring because of that. And it was, good from a community perspective because it got us all together and talking about this and finding money, resources, opportunities within the community. But it was, in the middle of it all. And, of course, we all know it's much better to do this in advance. And so that's my message, is getting people together in advance. And I know a lot of our partners on the call already do this or know this, but it reminds me that not only do we have to make our messages creative and interesting and eye-catching for our clients, our patients, we have to sort of keep messaging this correctly for our partners, because we have a lot of partners that may not be involved in healthcare throughout the year. Maybe they're providing services to seniors or their school, partners, others who, they want to support us, but they don't necessarily, it's not their job every day. And they know that they're going to support us during flu season. So it's a matter of trying to keep that message fresh for all those different partners. I'd also say working, of course, with the church community is really key, because they can be such tremendous supporters, and not only for flu, but for a lot of other vaccines, of course, for childhood vaccinations. Having that commitment and that really strong voice in our church communities makes a big difference. I could do that half the year, is work with those partners, because it's not only rewarding personally, but they can do a lot of great work.
Excellent. Thank you so much. And then I'm going to ask the same question of Claire. Any successes that you know of that your members have been able to actually have in relation to working in partnership to actually combat flu?
So, Catherine, you kind of mentioned it in talking about yourself. I mean, I think that the biggest success that programs, immunization programs, can support are these coalitions, and pulling together coalitions broadly with broad partners throughout communities. For example, hospital systems, getting all the providers together, the medical societies, all of those who give vaccines out, and then pulling them in with businesses, with pharmacies, with those that are in the communities, the McDonald's, the businesses that really care about the communities they serve. Catherine mentioned the churches, a really strong partnership there. And some of the things that pull coalitions together can be leveraged by the media. You can use the media to show, if you point out that you have low coverage rates, that can be something to pull communities together. Influenza cases, the outbreak. The upside of the outbreak is that you can really pull people together to make a difference. And so we've seen state programs support coalitions. It's really hard work to keep them engaged, to get leaders to be active, to get trusted members of the community to speak up and engage. So you have to put the effort in, but those are successful ways to increase your coverage rates, because you're getting folks from all different points in the community involved. You're reaching providers as well as those who are trusted and respected in the community, who might not be healthcare providers, but they can talk about the benefits of being healthy, and they can be a trusted resource for you. So I would push the coalitions and just go back to what Arlene had said, with all hands on deck and having that open communication. You don't want to push an agenda onto the coalition. I mean, the point really would be to listen to the stakeholders, listen to those who are coming together, ask them questions about, why coverage rates are low or why messages aren't resonating, and listen to them and get feedback from them and work to propose strategies that will work and that folks can buy in on and that folks can get more engaged in. Keep those coalitions active and going, and really engage not just healthcare, not just healthcare groups or healthcare providers, but also, like I said, those are trusted in the community.
Very good. Thank you so much, Claire. And I'm going to echo what you just said in relation to what Arlene had commented on earlier, all hands on deck. And I believe, Arlene, are you back on deck?
Yes, I'm back on deck now.
Very good. Thank you.
Hi, it's the technology, but I'm back on deck with it. And I would say also, aside from the community, because you really have to get down deep into the community, from the bottom of the coast. But one of the other things that we found out in Region 4 is if we reach beyond the federal quarter, i.e. to the regional health equity councils and to the directors of state offices of minority health, and to our faith-based partners and all the folks on the ground that we work with all the time, it seems to magnify the effect that we're having. So that's the other part of getting all hands on deck, is moving outside of the federal quarter and sometimes outside of the state quarter. It's been said by several of the other presenters that you just have to grab everybody that you can that's listening.
Very well. And Arlene, you have worked through a lot of barriers as well, including our technology today. But what roadblocks have you encountered that you were able to overcome in the work that you have done in Region 4?
Oh, that's a great question, Carlos, because I think there's always a roadblock, no matter what you do. But the biggest one, I would say, we said early on, is people, their attitude about getting vaccination. I still hear it all the time, even in my own family, where I don't need it. I argue with my son sometimes because he's grown now. And I think, by and large, that personal behavior, that's the biggest roadblock. And even when we put all our eggs in the basket on the federal side or with our partners in the community level to put our resources there, we still realize that we don't have as much leverage as we would like to have over individual behavior. So that's number one on my list, is that's a major roadblock. Yeah. The other
the behavior change often happens.
That behavior change is just tough. That's just tough.
But there are also sometimes issues at a larger level that can limit access. So I'm going to turn to the next question in relation to policies or initiatives that you are familiar with that have been helpful in relation to increasing flu vaccination. I'm going to ask Claire that question. What have you seen amongst your members that have made a difference?
So a few things that I would point out. One is standing orders. And standing orders are where it's allowed by state law, you enable eligible nurses and other healthcare professionals to, and even pharmacists, to assess the need for vaccination and vaccinate adults who meet certain criteria. And immunization programs have encouraged hospitals, assisted living centers, nursing homes, across the board to establish standing orders, so that it becomes routine for them anytime there's interaction with anyone to assess and to vaccinate. And so that's been very successful. I would also say that we're seeing some state and local immunization programs use their immunization registry to really monitor the influenza vaccine orders and to work with providers looking at their population to make sure they're ordering enough and make sure they're promoting it. And just that is a reminder to providers to really get the word out, give the vaccine when folks come in and promote it. Because like Arlene said, many people just don't think they need it or they're not reminded of it, and providers need vaccine prodding. And the IIS is a very good way once providers are enrolled and pharmacies get enrolled to give that reminder, to tell them, remind them who their populations are and that they should be ordering this amount of vaccine and they should be giving it. There are other policies that work, such as, mandatory vaccination of healthcare workers, but those are sort of limited to private organizations. But I think that the policies of standing orders, and anytime there's any interaction between the healthcare system and patients and workers, that there's some kind of reminder or some kind of click or prompt to vaccinate is good.
We've also seen that regulations to have healthcare workers wear masks if they're not vaccinated. That tends to increase rates. And so all of those things are good policies. I'm not clear, how that can go for, reaching underserved communities. But I think when you raise coverage rates in communities, in hospitals, in centers where seniors are, then you're raising you're rising a tide and raising all boats.
Excellent. Thank you so much. Catherine, I know that you have been instrumental in working with some grassroots efforts of getting some policy changes in California, and I would love to hear some of your successes in relation to advocating for some changes in policy.
We have had some successes. I wanted to expand on what Claire said about the healthcare worker vaccination requirements. There was a proposal or a law proposed to require flu vaccination or masking for healthcare workers in California. It didn't get signed by the governor, but many of our counties, I lost count, like 20 some counties in California, went ahead, the health officers made that a requirement for the hospitals in their counties. So that was still a win for us. And we also worked with our Health Officers Association to get a bill passed requiring child care workers to be vaccinated against measles, pertussis, and annual flu vaccination. And so, of course, that is focusing on those two sets of workers. However, especially the child care worker, I'm excited about that because that becomes another population that not only is, walking the talk, it's that they can be ambassadors for us as well, making them, once they're immunized, it sends a really good message that I'm protecting myself so your children are protected, and I'm more, and hopefully they're more aware of the childhood vaccinations as well. We've seen a really great support from the child care worker community and directors on this project. And, of course, we have our Vaccinate California group that's done tremendous work in for vaccinations for children and schools. So can't say enough about the power of parents and the power of advocates to get things done when you get the right combination and of folks together.
Great. I think it's a great lead into the next question because, as we know, we can do all the organizing that we need to. We can do a lot of education and getting the messages out to a larger audience. But we also know that those personal choices people make do make a difference, and that in terms of health, there's both a personal and a public component to it. And so I would love to know a little more about your personal influences, and if there's a flu vaccination champion who's inspired you and your work. And I'm going to ask that of Arlene. Who's that flu champion for you, or flu champion?
Who's that champion? It's just, I guess, knowing or believing that I have benefited from getting regular flu shots. I'm also a healthcare provider for many years before I came into HHS, so I know, the importance of that. And I think that's what has kept me safe. And until my son actually got grown and started thinking on his own, he was getting that too. But I think what motivates me most is just when I, look at, where we're going with this. No one should have an unpleasant experience or even mortality that's related to something that is so preventable. And that in itself is what keeps me going on trying to educate folks and just to keep them encouraged. And not just doing that through flu season, but talking about it year-round along with the messaging on our other health priority areas, whether it be opioid misuse, we're talking about human trafficking. I think, I see vaccination well before the season, talking about it, getting that run-up to it, so to speak. And because it's always in that basket of priorities, and because I think it's kept me safe and my family safe, that's what keeps me going mostly.
Excellent. How about for you, Rosanna? Who's that health champion that keeps you going and inspires you?
Carlos, this is, I love this question. I think I couldn't talk about one flu champion. I would like to mention that I think the partners that we have encountered during the campaign, during those years are the champions. Who are those partners? Of course, the staff of the Ventanillas de Salud, the agencies behind, who are taking the time to talk to the people and make them understand why it's important to get vaccinated, and understanding their healthcare needs to see how they can help them to get informed, to make well-informed decisions, and then the vaccine. So my champions are the network of the program, the promotoras, the doctors, the health coordinators, but also we have been very lucky working with the HHS, working with Walgreens, working with the churches, schools. So it's like, again, I think it's the multi-collaboration. It's the actors or the champions that deserve to be mentioned, and this is a teamwork, and I think that's the best way to promote the flu vaccine, and of course to reinforce the education part and overcome the myths. Yeah.
Yes, and in some ways, Hosanna, you've been my champion, but also I have cousins, primos, part of that whole Ventanillas de Salud network in Nevada, Illinois, Washington, Minnesota, Louisiana, D.C., Colorado, New Mexico. They have all been important players, and I've been so privileged of at least on 2 different occasions of meeting the majority of those people who are working on the ground and all the partners that they also work with in those individual states. And so when I heard you talk about 52 sites and then the mobile consulates, I thought, you keep growing, and that's amazing. That says a lot about the work you're doing. So I'm going to ask the same question to you, Claire. Who's your flu vaccination champion?
I would say, Carlos, there's nothing more powerful to me than the stories of those who have been impacted by flu. And if you go on the Families Fighting Flu website, or if you've seen any of their productions or their stories of their families at ACIP, reading those stories and getting to know a little bit about those kids and those parents who are now dedicated to fighting flu, there's nothing more powerful than that for me. So, that's what keeps me motivated. No one wants to see anyone be hurt or injured by flu, but certainly not children. And when you see that, it just gives you motivation.
Excellent. And how about for you, Catherine? What motivates you to keep going and promoting flu vaccination?
Exactly. I agree with Claire. The Family Fighting Flu website and a project that the CIC sponsors in collaboration with our Department of Public Health is shotbyshot.org, and that is a site with videos, written stories about experiences with preventable diseases. And the flu stories that come from parents who've lost children, and there's one in particular, it's not very long, it's about less than 4 minutes, Gigi's story. It's a woman who was previously healthy, came down as a teacher. She's in her 30s, came down with flu, nearly died, survived. But her story is like so many. I never thought I'd get the flu. I thought I was immune. I was exposed to all these children, et cetera. And it's very compelling. I know one of our goals is to get more stories in other languages, especially Spanish, to be able to tell those stories to a number of communities, because I think that is one of the most powerful ways. Those provider recommendations, those reminder recalls, et cetera, our providers are heroes that this was done. But these folks that share these stories are amazing.
Excellent. Thank you. And then I'm going to ask each of you to spend just 1 minute, because I know we've got a lot of questions coming up. What is the one piece of advice you can offer our listeners about working with underserved communities to increase flu vaccination rates? And I'll start with Arlene.
Okay, I would say that have that boots on the ground attitude, just stand boots on the ground. Grab everybody that you can. Conversation is key. Be truthful, be factual. Don't hide anything. Be transparent, and don't be afraid to engage others.
Excellent. Thanks so much. Claire?
Listen and establish trust. listen to concerns and just do not assume everyone has the same opinions or issues.
Excellent. Thank you. Hosanna?
I think engage the community, building relationships, and listen, as Claire said, listen to concerns and offering education in a culturally sensitive way. Yes.
Excellent. Thank you. Now, we have some questions from the participants online today. One question, actually, the first question is for Arlene. You talked at the very beginning about message fatigue. Can you explain that, and how is that people can be tired of hearing about flu vaccination?
Okay, I'd love to talk more about that, but sometimes, when we get the side of the commercials, or you look up and there's a billboard, or you might see a flyer, and what happens is you become desensitized, and it's not just for flu, but the federal government, and state government, we're known for, pushing out information. And then when we multiply that information through the partners that we're working with on the ground, it just becomes even more. And I think what happens in communities is they see one flyer, they see one commercial, they see this message, it's on the bus billboard or what have you, and we run the risk of them becoming desensitized. And that desensitization may impede, it just may be a block for them and say, I've heard it before, I'm not going to do it. That's what I'm talking about. There's no way to avoid that, because we do have to get the messaging out. That's the risk that we run, is that somebody is going to just, be desensitized from the over, information of messaging.
Very good. So one of our participants talked about her success as a media with the Hispanic community in partnership with Walgreens. And so the question that she is asking for Hosanna is, what has been the strongest successes for you in working in that collaboration with Walgreens?
Thank you, Carlos. I think the food clinics, and I was actually reading Cassandra's question about her experience with the Latino community. I think the experience was very different, Carlos, from one region or one state to the other. We have fabulous people from Walgreens that they were looking forward to have a lot of clinics, but then we have in some other places it was actually more challenging to get the clinics. But again, the most successful thing was to have this availability, this access to the clinics, not only at the Ventanilla de Salud, but also in different places that where we did health fairs in churches and other places. Yeah.
Excellent. And actually, I've had several questions about how important it is to work in collaboration with faith-based organizations across all different communities. And so it's very interesting. That's come up a couple of times in the comments I'm reading. But the other question I have here that's interesting is, what lessons have been learned in relation to promoting flu vaccination that could be applied to promoting HPV vaccination? And I'll start with Arlene with that question, HPV vaccination.
So I think the lessons learned that can be applied on the other side of another very challenging issue is that, as we've been saying the whole webinar, that it's important to listen, that it's important to be factual, to be transparent, to make sure that you're getting at the very base of the community level possible to engage everybody. And I think if you look at that and see where the successes have led us, for example, this past flu season, in Region 4, with our Walgreens partnership and all our partners that are on board with us with that, we've seen our rates continue to go up every year. And I think if we kind of take some of the strategies or the lessons learned from promoting flu vaccination, we can bring some of that over for HPV and the other ones as well. And that is, having the partnerships and et cetera. So there's a lot that we can borrow instead of starting over.
Excellent. Thank you so much. I'm getting bombarded with a lot of questions, and I promise you that if we don't get to your questions at this moment, we will post them as part of our resources. You'll get responses to all the questions that we have online. I have another question here from one of the participants, and I'm going to throw this question to you, Kathleen, have you worked with any homeless populations or any organizations working with homeless populations to promote flu vaccination?
Yeah, I haven't directly, but actually we're housed in an organization that has a wonderful group that focuses on finding housing for homeless folks and resources. Sacramento has some great partners. And, of course, they try to connect them with healthcare services whenever they can. So I'd say that's where coalitions come into be very, very handy to be able to connect everybody with that. I think that the homeless, in our area at least, are the homeless groups, home people who serve the homeless are pretty well connected with our medical folks. But if you don't have that connection already, give folks a call, let them know who you are and that you're there to help connect them with those resources, because that is a huge need, and it'll help keep them out of the healthcare services.
Absolutely. And I know that we have worked with several partners through NIVDP in certain health jurisdictions with those individuals that are working with homeless populations. And if you go to the CDC website, there's a community resource kit, and there are 3 examples of successful outreach efforts. So that's something, again, that we'll share with all of you after the session is over. I have another question, and I'm going to throw this question over to you, Arlene. What about doctors who are hesitant in actually recommending flu vaccination? How do you work with those doctors?
Oh, that's a really good question, because I hate to say that I know some of the docs, but, again, you can't use that as an excuse to not continue to work with them. I think at some point in time, 1 or 2 things is going to happen when you continue to have a conversation with our healthcare workers. They're either going to retreat and just kind of give up, or they're going to eventually come around. And so the strategy for me is to continue the conversation and to continue to put it there in their, whether it's in their monthly meetings or what have you, because at the end of the day, they are pillars in the community, just like a preacher or a deacon or someone would be. And that's the message I try and give to them. People are listening to you because you're the doc or what have you. And they need you on board as much as possible. But again, it goes back to their own behavior. And as I said earlier on, that's a hard hill to climb, even for healthcare workers.
Correct. Excellent. Thank you. We have at least 3 or 4 questions specifically asking about how to actually become more involved in the collaborative effort with Walgreens and HHS. And so what we're going to do is we have actually a tip sheet, a fact sheet that we've developed, and then we can circulate that after the session as well. It gives you the ins and outs of how to navigate through the asks of having Walgreens as part of your efforts locally. I'm going to have time for one more question, and it's kind of interesting. I'm not sure who this participant is, but wanted to know a little bit about other kinds of disciplines, including chiropractors and their usefulness and their ability to be a partner in promoting flu vaccination. And I'm going to throw that question over to Claire. Other disciplines besides, family doctors and what we normally think of as
I would say that the same principles of working with providers will hold for working with chiropractors and working with others who have contact with patients. They know that they are a trusted source of information, so reaching out to them and encouraging them to participate in coalitions, showing them the value of vaccines, reminding them they are a trusted source. If they don't give vaccine, they should at least recommend it. There are standards of care for adult vaccination that include recommending vaccine if you're not giving it. So I think it's just encouraging all the providers, including chiropractors, pharmacists, even those that give alternative medicine, encouraging them to be a part of your coalition, to join the conversation, to have the conversation with patients, and to encourage vaccination when folks come in. It's an important piece.
Thank you so much. We've had a lot of questions. We've had a lot online today. I can't thank you enough for joining us for today's webinar. When I was thinking back about the history of the NIVDP and the great work that we've done with the partners, it's been people like all of you who have been on the panel who have made a huge difference. So I thank you for being here with us. Thank you to all the team that's behind the scenes from Kaufman and Associates and HMA, and all the great people at HHS and CDC who make all this possible in collaboration with all our partners. Adam, I know you have some last-minute business.
Yes, thank you, Carlos. In closing, I would like to remind everyone that today's webinar was recorded and that the slides and recording will be made available on the NIVDP partner page at cdc.gov. Thank you again for joining today's webinar. We have 3 poll questions. Our session is now concluded. Thank you.